So we have reached a point where second year has to be taken seriously.
So either way, all they have to do is continue learning whatever examination that has been asked in the past.
That's a choice. I mean, you can chill if you are ready to really, press the accelerator towards the end. That's also perfectly fine.
So what will the student should do to remember it?
Pharmacology is a collection of entire questions that has been asked in the past in different top medical colleges.
If you think of common things, you will be commonly correct. And if you think of rare things, you will be rarely correct.
Instagram बाहर भी कर सकते हैं, lunch के time पे भी कर सकते हैं. But that time that we're spending in front of the patients, we can make a good use.
You be there every single day, 10 minutes at least in a day, something will go inside. So hello guys, welcome back to PW MedEd YouTube channel. Once again, I am Dr. Anjit and I have Dr. Siraj sir, Pharma ke Badshah, and Dr. Sudha ma'am. Ma'am told me not to say anything, but eye-catching Dr. Sudha ma'am who's going to teach you ophthalmology in future, and we have the most calm and composed Dr. Santosh. So the purpose of this discussion is very, very simple. So we have reached a point where second year has to be taken seriously. Like it's 4-5 months is done, and in the next 4-5 months you are going to have your exam. Anat, physio, biochemistry troubled you. Pharm, patho, micro also will trouble you, right? So we are going to discuss about what students has to do in the next 4 months of their second prof, and to get an amazing rank, amazing mark, and have the concepts ready as well. And I'm sure there are a set of students who have been hardworking from the day one when this click go. So how they can improve, and if someone is saying that, okay, 1.5 years is done, let's me become serious. So what to do for them, and also, like I said, we have Dr. Sudha ma'am and Santosh sir who will also guide you on how to tackle the morning syllabus of your clinical postings, how to use it effectively. So if you're first time here, click on the subscribe button and let's learn pathology, medicine and discussions together. Sir, Siraj sir, so tell sir, like you have been interacting with students every single day. So these two groups of students, what is your take on how they should go about the rest 4 months till the exams are there?
So right now, most of the students, they have started already. Either they have started with us or they have started, let's say, from their university lectures that is happening. So either way, all they have to do is continue learning whatever examination that has been asked in the past. They will have to look at the topics.
True.
Because एक जो professor का mindset है, we have to understand. चाहे वो नीट पीजी का हो, चाहे वो प्रॉफ एग्जाम में हो, दे आर गोइंग टू हैव सिमिलर काइंड ऑफ माइंडसेट. तो पिछले 3-4 एग्जाम के 4-5 एग्जाम के पेपर लें एंड यू सी कि कुछ टॉपिक्स हैं जो बार बार रिपीट हो रहे हैं. फॉर एग्जाम्पल अगर CNS की बात करें तो एपिलेप्सी में आइदर देयर विल बी राइट शॉर्ट नोट ऑन फेनिटोइन और वैल्प्रोएट और कार्बामाजेपिन, राइट? और देयर विल बी अ टॉपिक राइट अ डिफरेंसेस बिटवीन बेंजोडाइजेपिन और बार्बिट्रेट. दैट इज गोइंग टू बी देयर. तो ये फिक्स है. ये हर मेडिकल कॉलेज में, इंडिया किसी मेडिकल कॉलेज में माइंडसेट ऑलमोस्ट सेम है. तो दे विल हैव टू स्टार्ट लुकिंग ऑल दोज क्वेश्चन पेपर्स एंड दे विल हैव टू स्टार्ट स्टडिंग रेट्रोग्रेड कि ये टॉपिक आए हैं, इन टॉपिक से हमें पढ़ना है, बिकॉज अगले एग्जाम में भी इन्हीं सबसे टॉपिक आ सकता है.
Great, sir. Ma'am, question to you. Were you a sincere student from the day one, though I know the answers, so I'm asking you, from the day one of starting the exam, or you're a person who's like, who will burn the midnight oil 2 to 3 months before the exam? Or both?
I used to study from the beginning only, but not very intensively, but I was reasonably regular with my studies, and towards the end it would become a little more intensive.
Okay.
So I was of that, but that's a choice. I mean, you can chill if you are ready to really, press the accelerator towards the end. That's also perfectly fine, because in college it's important to enjoy also, but then you have to be really intensive towards the end.
Santosh, about you, like were you like this when you're in MBBS? Like I have a schedule, I have to do this in the morning, evening, night, perfectly following it 100%, which is very, very tough. Or you're like chill in the early half and do much more active work in the late half?
Okay, my answer is like I was both. In the sense, कुछ subjects ऐसे थे which I liked, and I religiously studied them. From cover to cover, I put effort to study cover to cover. And some subjects ऐसे थे which did not like me. The subjects did not like me, so they were reserved. When exam is just around the corner, पिछले दिन पढ़ लिया, just vomit it out in the exam, and same evening forget everything.
Okay.
So I followed both.
So that's a good thing to say. It's not about the subject, you liking the subject. The subject didn't like Dr. Santosh. So that's a good attitude. No, I am good. Subject is, it's a problem with the subject. Subject's problem. Hai. So sir, Suraj sir, like you told that that's a pattern of things which keeps coming in every university exam. That's what we primarily do in Faray. Like we tend to compile all the university exam thing, and we also tell them how to write a paper. Sir, there are few sets of students, because a few students who regularly attend the live lecture, some of them say that, sir, I know the concepts. Everything is fine with me. But sab bhul jata hai. So what to do? So what will the student should do to remember it, or maybe to accelerate it? So because they have done an amazing job. And if the first internal, if they're not able to properly structure the question, they don't get marks, they get demotivated. So will the same thing happen in the final exam? Because everyone is working for a result.
Definitely it happens.
What is the thought process, or what a student who has been very, very religious from the day go and is ready to prepare an exam which is theory based predominantly and 20% of MCQs, how should they structure the next 4 months for them?
Sir, definitely whatever you said, that happens also. So that is why the students, those who are attending regular live classes with us, at the end of the class, we always give them a homework. I give them a homework that you write, send it across to me. I will be acting as the examiner and will assess that if I have given you a 10 marks question, what should be the score? So if I'm giving, let's say 6.57, that is going already on the good side, better side, they can improvise more. So what they can improvise, I'll be giving them comment in the same evening or the next morning, they'll receive. So why we are doing this exercise is knowing a topic is a different thing compared to what you are going to write. Because for writing, you have to be very, very strategic. For example, if they are asking, let's repeat the same topic, that write short note on phenytoin. So what all things you have to write? You know everything. You cannot write directly side effect in the very first go. So you will have to write phenytoin is anti-epileptic drug from this particular class. It also acts by blocking this. So you have written mechanism of action. Then phenytoin के uses. किस किस सीजर में यूज़ करेंगे? जब यूज़ किया तो contraindication, absence सीजर में क्यों contraindicated है, right? You will be writing that. इंटरैक्शन, जैसे कि फार्माकोकाइनेटिक्स में आ गया, क्या क्या इंपॉर्टेंट पॉइंट्स है, जीरो ऑर्डर वाला है, तो इट शुड फॉलो ऑर्डर. देन इन द एंड यू विल बी कमिंग अप विद द साइड इफेक्ट कि ये साइड इफेक्ट है. नाउ विल बी टेलिंग लाइक लेट्स से 15 साइड इफेक्ट, बट स्टूडेंट डोंट हैव टू नो 15 साइड इफेक्ट. अगर नोजिया वोमिटिंग के आगे कुछ और लिख दे तो है ना, दैट इज गोइंग टू वर्क. तो फॉर एग्जाम्पल ही विल हैव टू राइट अबाउट, लेट्स से एग्जामिनर विल ऑलवेज लुक मोस्ट कॉमन साइड इफेक्ट है कि नहीं. नोजिया वोमिटिंग सब लिखते हैं, लेकिन गम हाइपरट्रोफी किसने लिखा है वो एग्जामिनर देखेगा, है ना. ऑस्टियोपोरोसिस किसने लिखा है वो एग्जामिनर देखेगा, है ना. स्किन रिएक्शन, पर्पल ग्लव सिंड्रोम, ये जिसने लिखा है एग्जामिनर विल बी गिविंग मार्क्स स्पेशली टू देम. सो एक तो ये है कि स्टूडेंट स्टार्ट स्ट्रेटेजाइजिंग दिस वन. दूसरा ये है कि जो अभी तक कुछ भी स्टार्ट नहीं किए हैं उनके लिए, जैसे आपने भी मेंशन किया था फरे सीरीज़. व्हाट इज़ फरे सीरीज? नाम थोड़ा सा ट्रिकी लगता है ना, ऐसा लगता है कि फर्रे ये लोग क्या बता रहे हैं ना. लेकिन फरे सीरीज इज नथिंग, इट्स अ कम्बरसम, नॉट अ कम्बरसम, सॉरी. फरे सीरीज इज अ कलेक्शन ऑफ एंटायर क्वेश्चंस दैट हैज बीन आस्क्ड इन द पास्ट इन डिफरेंट टॉप मेडिकल कॉलेजेस, है ना. तो CNS से क्या 10-12 क्वेश्चन आ रहे हैं, या ANS से क्या 12-15 टॉपिक रिपीटेडली आ रहे हैं, उन्हीं का समरी है. सो इफ़ यू आर रीडिंग फरे, व्हाट इज़ यू आर गोइंग टू डू इज़ अपने एग्जाम में आने वाले प्रोबेबिलिटी 70 to 80% जो क्वेश्चन आ सकते हैं, इट इज़ ऑलरेडी इंक्लूडेड देयर. तो फरे लेकिन उसको ज़्यादा हेल्प करेगा जिसका थोड़ा बैकग्राउंड नॉलेज है. बिकॉज अगर पहली बार फरे देखोगे तो यू विल हैव टू डू रटाफिकेशन. बिकॉज रेगुलर क्लासेस में जब हम पढ़ाते हैं तो हर चीज़ की एक लॉजिक देके पढ़ाते हैं कि ये है मैकेनिज्म ऑफ एक्शन, तो स्टूडेंट नो. फरे उसको ऑर्गेनाइज करने में हेल्प करता है. सो दे विल हैव टू स्टार्ट प्रैक्टिसिंग, they'll have to start looking at कि क्या previous question आए हैं, and at the end of everything Furry will help them in strategizing how to write the answer sheet.
Great sir, very well said sir. Like sir said, learning is different, presenting is different.
Exactly.
We need not teach the current generation of how to present themselves.
Exactly.
They are like
well presentable,
way better than us. So it's about how you organize and structure a question.
Exactly.
It has like, if it's most of the LAQs come with a scenario based question. So data points A है. So what is the most probable diagnosis, differential diagnosis, and first and sub questions. So if you can structure it, and for structuring you need a little bit of practice. That's what Furry primarily does for you. So you already known, you already read our lectures, being with us for 1 year. So Furry will amplify your effort and make it much more productive, so that we can get the distinction or honors we look for, not just the PP and P. So great sir. So ma'am, second year exams are over. So Siraj sir and Mamta ma'am will take care of their second year thing, and they will definitely clear the exam in flying colors. So the morning part of the second year, which I feel is very important, because I feel that morning part of the second year is the journey or transition between a student to a doctor. The same way from 12th standard they become first year MBBS. This is very, very important, so that that's where they go and talk to people. That's where they get used to people. So how a second pro student can utilize the morning postings? Over to you, both of you, ma'am. How, sir, ma'am and sir, how they can best use it from your experience? What's to be done and what's not to be done?
According to me, as you said, this transition is very, very important from being a student to transitioning to be a clinician. So, first you have to go and learn how you go and you observe what your teachers are doing, your senior residents are doing, how they take history, how they talk to the patient, how they conduct themselves at the bedside. Because now when you go with that white coat, they look upon you with a certain level of respect. So how to speak, how to conduct yourself in a ward environment, these are things to be observed and learned. And then I think that bedside clinics is the cornerstone of becoming a good clinician. It actually does not matter what subspecialty you do in the long run. The clinical acumen that you gain in your MBBS years is what stays with you for the rest of your life, whatever subspecialty you practice. So I think it's important that you start with developing basic clinical skills, which is learned from, there are textbooks which Dr. Santosh will elaborate on. And you read those textbooks, you learn examination techniques, you learn how to take a good history, what questions to ask, how questions are to be framed, and you learn the examination techniques. If you have an opportunity, palpate, auscultate, see the patient, try to form your own differential diagnosis. And if you get to see a case in the ward, like for example you see a case of pleural effusion, come back and read about it from the textbook. Like I have the opportunity of seeing a pleural effusion today. I am in that kind of a medical college which gives me the opportunity. I come back, I read about the case. So what happens is, like, a little bit of medicine and a little bit of surgery, everything is actually covered from your second year days. You don't have the burden of doing all this in your final year. In your second year itself, you know that this is how pleural effusion presents. And also you develop the clinical eye. As the more cases you see, I think the better you become. And like when you read from a textbook, you tend to memorize things, randomly. When you look at cases, it helps you to understand what is more common and what is less common. Like I'll give you an example. After I finished my internship, I was doing house job in general medicine for some time. So like one day in the ward rounds, our consultant, there was a patient of splenomegaly, and at that time I was preparing for NEET PG. So I was also randomly memorizing things like this. So he just asked me in the rounds, tell me the causes of splenomegaly. And then, like I had memorized, I told him the whole list. And it turned out that I had missed out the most common cause. So then he told me something which I remember till today, and it actually has helped me in my practice. He said that, Sudha, if you think of common things, you will be commonly correct. And if you think of rare things, you will be rarely correct. True. And that is something you develop only by going to the wards. True. So never ignore clinical postings. What can be learned and the bedside cannot be learned from textbooks. Your patient is perhaps your biggest teacher in a medical college. True. And the rest, I think Dr. Santosh will tell you. Being our medicine faculty, he'll tell you which books to read, how to go.
Rightly said, ma'am. Ma'am, Santosh sir, ma'am ne bola like you need to observe, you need to take care of the initial parts. And one thing which ma'am said was very, very true. Textbooks can teach me theory. Textbooks can teach me right or wrong. Textbooks can never give me experience.
Correct.
Because medicine is about experience. It's about, you will know when you go to a certain level, you know this is how it is. You might not be able to explain, but that comes with experience. So what a second year student should actually do because medicine is something which is elaborate, which is vast, and no one can master it. So because for a second year student, there's second year, clinical posting of medicine, third year, as well as in final year. So what they can cover and what they should cover in the second year.
Yeah, so I'll come to that. So before that, first thing is, it's about mindset. Pehla thing hai, most of the students think that this is a redundant posting. We are not learning anything and we are just putting that 2 hours time. Somehow attendance ke liye kar rahe hain. They have to come out of that mindset. इतना तो कन्विंस करना है हम अपने आप को कि करना है, अटेंडेंस के लिए तो करना है. वी हैव टू बी इन द वार्ड. वार्ड से बाहर जाएंगे तो पकड़ लेंगे और अटेंडेंस एब्सेंट मार्क हो जाएगा. सो द 2 hours दैट वी आर स्पेंडिंग इन दैट वार्ड, हम कर क्या रहे हैं? या तो चिट चैटिंग, गॉसिपिंग कर रहे हैं या इंस्टा स्क्रॉल कर रहे हैं. इंस्टेड लेट अस पुट दैट टाइम फॉर अ राइट यूज. इंस्टाग्राम बाहर भी कर सकते हैं, लंच के टाइम पे भी कर सकते हैं, बट दैट टाइम दैट वी आर स्पेंडिंग इन फ्रंट ऑफ द पेशेंट्स वी कैन मेक अ गुड यूज. सो पहला है कि टाइम एस्केप नहीं है, सो लेट्स यूज इट इन अ बेटर वे. हाउ टू यूज इट इन अ बेटर वे, एंड अपने आप को स्टूडेंट्स को कन्विंस करना पड़ता है कि द टाइम दैट आई एम गिविंग हियर with the patient is giving me the results in return, because at that point of time they do not realize that they're gaining something.
And that's something which is not an immediate feedback for them. It will take years for them to understand, okay, it's actually important.
So just एक example है. So whenever we correct answer sheets of prof students, sir ने बताया ना common side effect क्या लिखते हैं, nausea vomiting. बट जहाँ पे लिखना था कॉमन साइड इफेक्ट मैंने कभी भी नहीं देखा. लाइक वी आस्क्ड देम टू राइट अ शॉर्ट नोट ऑन मैनेजमेंट ऑफ पार्किंसंस डिसीज, so they write levodopa and all. There I want to see the answer nausea vomiting. Levodopa in practice it becomes a limiting factor कि patients they don't want to take it because it is inducing nausea and vomiting.
And that you never forget when you see a patient.
हाँ, so एक बार क्या हुआ, we were doing this rounds and then one patient is like मैं नहीं ले सकता हूँ ये, जब से आपने ये टैबलेट स्टार्ट किया है खाना पीना मुश्किल हो रहा है because it is triggering severe nausea vomiting.
True.
So then they learned that day that levodopa का एक significant
side
not
effect.
just book mentioning side effect, significant side effect है nausea vomiting. Now that batch of students will never forget it.
True.
Right. So when जानबूझकर मैंने उनके assessment में I asked this question, management of Parkinson disease, and everyone made sure that they mentioned and they used my words that it is a limiting factor in prescription of levodopa. So they learned a very essential clinical tool. So similarly, there are a lot of learning points which they do not connect immediately, but in the subconscious mind, it keeps registering. So when they reach the final year, they are quite mature clinicians.
Perfect.
But if they don't take it seriously, then they are what in today's generation कहते हैं ना nibba nibbis of medicine. They know theory, but they have not learned the essence of it.
True.
And just to give you another analogy, my wife has a driving license because she knows all the rules, laws as well about the driving. But when she is on the driver's seat, मैं राम राम जपता हूँ because she knows the theory, but practical she has not done that much. So maybe few months, few years down the line, she'll be a good driver. But कुछ चीज़ें हैं जो करके ही हम सीखते हैं.
You have to jump inside.
हाँ,
That's all.
करके ही सीखते हैं. So examination and all you have to do, then only you learn, not by reading. So there's no compromise on.
Great, sir. If you guys have noticed, actually, Santosh told a very subtle thing which will actually help you, because anyway you're going to give your university exam there. You're going to pass there. Santosh told the student wrote nausea vomiting in the same line what I told. That's the impact you create in a viva.
Yeah.
Because the teacher has taught it, you listen to it, you tell the same answer, I'll be very happy. I'll not just put pass, I'll put 60-70%, right? So that's the smart thing. So you have to learn between the lines. That also you get more when you go to the clinics. How to learn between the lines. I think you guys will definitely attend the postings. Don't skip postings. Like sir said, at least for attendance, be there. If not for 2 hours, physically be there. You be there every single day, 10 minutes at least in a day, something will go inside. Just because you have been there, right? So I hope you guys will become amazing clinicians, and hopefully when we become old, we are going to look up for you, right? So we hope that we'll be in good hands for sure. So thank you, sirs, and thank you, ma'am, for giving your time. And if you guys have any comments still about medicine, ophthalmology, pharmacology, or pathology, or anything under the sky with medicine, put in the comment section. I'll be more than happy to answer your queries. See you soon. Thank you. Bye-bye.